Concerns about a new COVID variant rattling markets and triggering new travel bans around the world. Tonight, we'll provide some context and clarity. We'll break down what scientists know about this variant and explain why health experts say people should not overreact just yet. Researchers first identified this new strain in South Africa earlier this week. Today, a World Health Organization panel named the variant Omicron and labeled it as a variant of concern. Health experts admit there are still a lot of unknowns about this variant. They don't know if it's more contagious than Delta. They don't know if it causes more severe disease. And they don't know how it stacks up against our vaccines. Still, the White House says it's taking action out of an abundance of caution. The United States will restrict travel from South Africa and 7 other countries in the region starting Monday. Reporters asked President Biden about the new policy early today.
We don't know a lot about the variant except that it is a great concern. It seems to spread rapidly, and I've spent about a half hour this morning with my COVID team led by Dr. Fauci, and so that was the decision we made.
Now, so far, more than a dozen countries have restricted flights from South Africa. They include the UK, Germany, Israel, Italy, and Japan. The new variant also spooking Wall Street. Take a look at the Dow plummeting more than 900 points today, its worst day of the year. We have coverage from all angles tonight. Dr. Robbie Sicca on how this new variant compares to previous strains. Sarah Eisen on the potential economic fallout. But first, to our senior health and science correspondent, Meg Terrell. And Meg, no confirmation that Omicron has been detected yet in the U.S., so where has it spread so far?
Yeah, Kelly, so far, most of the cases have been detected in South Africa, with a few others in Botswana, Hong Kong, Belgium, and Israel. But it raised red flags in South Africa so quickly for a couple reasons. First, how fast it's taken off. Researchers there showed this graphic in a health department presentation yesterday. It shows the prevalence of different variants. Now, the red is the Delta variant, which was associated with the country's terrible third wave of infection. In the blue, all the way to the right, is the variant now known as Omicron, appearing to gain ground against Delta very quickly. Now, there are several caveats to this, though, one being that cases had come down quite a bit from the Delta wave, so it's not clear if and to what degree Omicron is outcompeting Delta. Cases now in the country are just starting to surge higher, and what authorities are concerned will become the nation's 4th wave. Now, the other major concerning feature of this variant is that it contains more than 30 mutations in the spike protein, and some are known to potentially evade immune protections, either from vaccination or prior infection. The WHO cited both of these concerns in its analysis today, noting more work needs to be done to understand both of those questions. Now, as well as whether the variant's associated with more severe disease. There are a few pieces of good news, though. One is that the variant can be tracked using PCR testing because of a marker in the way the results show up. So that'll help with monitoring its spread. And 2 is how quickly vaccine makers are responding. Pfizer and BioNTech and Moderna say they could have new batches of vaccine ready within about 3 months if updated versions are needed. Both Moderna and Novavax, another vaccine maker, say they're already working on variant-specific versions just in case. All the companies are assessing how well their vaccines are likely to work against Omicron, with those results expected within a couple weeks. Kelly?
Meg, thank you so much. Our Meg Terrell tonight.
Shepard Smith here. Thanks for watching CNBC on YouTube.